Hello everyone. My name is Saurabh. I welcome you all on behalf of Geomedics Pharma to this webinar. I'll just introduce Dr. Fabián, who is reconstructive and plastic surgeon from Argentina. So he has written 26 scientific publications and 5 different chapters in aesthetic dermatology books. He is a member of 5 different plastic surgery societies, and he has received 2 awards from Society of Plastic Surgery. He has enhanced more than 170 conferences and webinars. He was moderator, coordinator, and director in 28 scientific sessions. He is capable of medical technology companies like Endymed, Lutronic, and Alma Lasers. He is a founding member of Argentine Society of Lasers and Medical Technologies. And he has been designated as an expert evaluator of postgraduate careers. And now he is elected to be president of 26th Buenos Aires Plastic Surgery Symposium that is held in 2024. So over to you, doctor. Would like to listen from your insight on hyperhidrosis.
Well, thank you so much. Thank you for the introduction. Hello, everyone. It's a pleasure for me to share my experience with this platform for this particular illness. I'm going to share my screen. Can you see it?
Yes, I can see.
Perfectly. Well, this is me. I was just mentioned by Saurabh. I divide my presentation into topics. This is the principal, what I do fractional post-microneedle radiofrequency in the treatment of hyperhidrosis, but at the same time, I want to mention my experience nowadays and in daily days for the microneedle radiofrequency at my office. These are my conflicts of interest. I start mentioning that ISAPS is the Society of Aesthetic Plastic Surgery more important in the world, and they made a survey every year. In 2018, they found that there an increase in all non-surgical procedures of close to 10.4%, but was made by an increase of total injectable treatment. 2 years later, and in pandemic time and during the restriction time, even that they appear increase close to 6% of the non-surgical procedure. In this case, by my other treatment. When they talking about other treatment is medical technology treatment. My country, Argentina, don't escape to this reality, and more than half of the treatment, all treatment of plastic surgery was made by non-surgical procedures. Aging process. This happens right now in all of you and on me too. We lost 1% of our collagen cells day per day, year per year, sorry. And we need to fix that and make something. One of the treatments we can choose to have a solution is the use of radiofrequency. Try to send close to 52 to 55 centigrade inside the dermis to stimulate our fibroblasts to produce more collagen cells. And at the same time, keep safe, maintain our temperature over the surface on the epidermis no more than 40 to 42 centigrades. This is a clue to have not have any problem, to avoid burns or avoid injuries. When we're hitting the skin, we have two different kind of reaction. The first one, the immediate effect, is a collagen contraction, and a long-term effect, a collagen remodeling. Both of them finally obtain a skin tightening and a wrinkle reduction when we talk about skin face rejuvenation. It's different when we talk about put the focus of the radiofrequency on the surface, on the epidermis, we obtain rejuvenation. If we act at the dermis, we obtain tightening. And if we act at the hypodermis, we obtain contouring, all with the same device, all by the radiofrequency. The goal, one of the important goals of the radiofrequency platform is we can add in a different kind of color skin and every time of the year. We don't have a problem with the season. we don't have problem to reach a PIH. I select this device, have a lot of power, 85 watts of power, and they have different kind of handpiece. I select the 3 ones. Here are the total of 8 handpiece, but I choose the 3 one because I put the focus on the treatment, on the facial treatment, specific facial treatment, because I have another device for body contouring, non-surgical body contouring, but you can have all of these. And I put focus only in the intensive handpiece. This is the screen of the device. When I select intensive, I can choose the pulse width between 50 to 200 milliseconds. I can choose the power up to 25 watts, and I can choose the depth until 5 millimeters of depth. When we talk about the different kind of microneedle, as you remember, if we have an insulated microneedle, the action is only on the tip. That's why we can reach less quantity of layer or less quantity of surrounded skin being treated. If we have an insulated and non-insulated needle, we can act in all the whole needle, and the way we can avoid complication, avoid burn on the surface is about the different impedance, different reaction of the impedance of the layer of the skin. Our epidermis have a high resistance for wave frequency. That's why it's easy to be absorbed in the inside of the dermis because have low resistance to the impedance. It's a matter of less work. The radio frequency flew to the dermis because don't have any kind of resistance to the energy. There's different kind of microneedle, easy and cheaper than manually, but it's traumatic. Usually short needles and it's uncontrolled. The second one, look my hands, do a great punch. It's like a shot. It's really fast and strong. That's why, in my opinion, it's impossible to be sure that the needle reach the dip that you choose. And this one that I want to select is electronically controlling motorized insertion. They obtain a SUF and controlling insertion of the needle. That's why you can reach the dip that you choose. This is the handpiece, have disposable tips. These tips have 25 microneedles that are not insulated, that I mentioned, a total of 300 microns of width. They're gold plated, super sharp, it's important. They taper needles that allow a good penetration. We can go up to 5 millimeters of insertion depth. We can increase and choose every 0.1 millimeters, sorry. And the area that we can treat is around 10 by 10 millimeters. As I mentioned, it is possible. We have a total of 1,000 pulse. Finally, we have a fractional pulse mode to send this energy. I love to compare this way to send energy like a train full of wagon that must reach the station to release the load. What does this mean? We apply the energy, and as a train with a lot of wagon, they need to be sure they reach the station, reach the dip that you select, and then release the load, release the energy. That's why, for me, it's really safe. And here with another drawing showing the difference. If you have this kind of needle, as you can see here, we can reach more surface, more quantity of dermis. That's why, for sure, I can reach, for example, in hiperhidrosis, more quantity of tangle of sweat glands. I mentioned the difference between the resistance to the wave frequency. We mentioned that impedance. Well, while our epidermis have a high resistance for the radio frequency, our dermis have a low resistance. That's why it's a matter of less work. All the energy flew through the dermis without be absorbed to the epidermis and the hypodermis. That's why we can avoid injuries. Here is animation in which we show the train with the wagon reach to the station and then send the energy. Again, in a shallow surface, 1.5. Again, you obtain the penetration of the needle, a soft penetration of the needle, and then send the energy. Fortunately, I was invited like a speaker, like a faculty guest, to the IMCAS World Congress last month in Paris, and I was present in these sessions, microneedle radiofrequency session, in which different actor of the different company with these kind of devices, microneedle radiofrequency devices, talk between them, have a great discussion about pros and cons. I realized that the first two examples mentioned that successful treatment was patient treated by me. Well, I'm really proud to see that, and I showed you that. This is one of the patients, this is the second patient, and I show you in a few minutes. When you talk about neck laxity treatment, for sure, you need to look only for or microneedle radiofrequency, or HIFU. In my hands, I prefer microneedle radiofrequency. This is the way I act. Look the trick. I pinch the skin to be sure the needle go to the dip that I select, because if I don't do it that, maybe the needle touch the bone of the mandibular and don't go to the dip that I select. On the front view, you can see close to nothing in the change in this patient, but in the profile, look the white arrow, look the great quantity of contraction in this skin in the patient, young patient, to don't have any kind of surgical indication. Or this patient in this profile, maybe you can see close to nothing, but in this other profile was a patient that I performed a liposuction. After that, I have a lot of excessive skin. That's why I apply the radiofrequency, and these are the parameters that I use in 3 sessions, and this is the amount of contraction that I can obtain. When we talk about agnostic well with this device, this is the patient was showing during the IMCAS Congress. This is the front view, another view, 3 sessions, and these are my parameters that I choose for these patients. And it's better to see the result in this profile view to notice the reduction of the scars. When you talk about skin sagging treatment, this is a patient of mine. I'm really happy with this result, the patient 2, but if you see in the front, I want to give you a close view. I obtain a sagging fibrosis around the navel, and the patient are disappointed with this result. Well, I give a solution, I give her a solution with this device. In 3 treatment, I obtain this smoothly quality of skin. I avoid this saggy skin that was obtained after the procedure. When we talk periorbital treatment, I usually combine the fractional radiofrequency with this microneedle device. I first apply the fractional handpiece and then the microneedle. It's important. Look, my right hand, I use the left hand. I look for the rim of the orbital area. I look the bone and put the needle directly, look for the bone to be sure to avoid injuries to the eyes. And this is the quality of my result in only 1 session, close view, to measure the quantity of contraction of the skin in the upper eyelids. And after 3 sessions, my result. Again, another patient that I performed a surgical procedure, facelift, chin implant, and rhinomodulation, and at the same time, a blepharoplasty. Everything was okay, but I was not successful on the eyepill. I not cut enough quantity of skin. That's why I need to give her a solution. The solution was made by this device, as I show you here. Look that after 4 sessions, a great contraction of the upper eyelids, and the patient are really happy again with me. And I can use like a delivery drug device. As you know, we can put topical solution or inside the skin. In this case, it's corticosteroid plus 5-FU to reduce this keloid, symptomatic keloids. After applying the solution, I start to use the microneedle, close to nothing of power, but with the a penetration of 3 millimeters to be sure to reach all the layer of this scar. And this is before and after. As you know, it's impossible to erase a scar. I only get improved in the quality of the skin in the left breast and in the right breast. Finally, we reach our principal topic: why fractional post-microneedle radiofrequency in the treatment of hiperhidrosis? Well, first, I need to mention that if you put these phrases and look by internet, the less hygienic celebrities, you can find this all embarrassing moment of people from movie, sport stars, and even people from royalty with this problem in the armpits. And usually people in general associate sweat and armpit odor with poor hygiene and lack of personal care, but nothing is further from reality. These people suffer a lot about the opinion of other people. That's why they really care about that, and they change the behavior and do a lot of things to avoid other notice that they have sweat or odor on the armpit. In addition to the hyperhidrosis and osmidrosis disease, everyone with high social or labor exposure like us need to think about this treatment. Imagine you during an appointment with a patient and you have odor or you have sweat in the armpit. It's an embarrassing moment, and maybe this is a solution for you too. I give you this definition of hyperhidrosis: is the excessive sweating that occurs spontaneously without being caused by high temperature or by situation of physical or emotional stress, and whose chronicity interferes with the usual work and social activity. In summary, excessive sweating without any stimulus or reasonable cause. Important to mention that the symmetric began in childhood, is really often in pretense. Look for this magic number. 3 to 5% of all world population suffer about that nowadays. Approximately 2.5 million Argentines, because I live in this country. These are among of future patients. Look for and put the point in these future patients. Appear most frequently in Asians, especially in Japanese. Close to half of them have hereditary. That's why we mention an family illness. Grandfather, the father, and the grandson is going to suffer about that. And usually, the more frequently of the hyperhidrosis are the axillary hyperhidrosis with the 60% of the cases. What is osmidrosis or bromidosis? It is the secretion of the apocrina glands. These glands create obtain a secretion of ceramides, and this ceramide is different for each other person. When these ceramides came in contact with our usual bacteria on the skin, on the armpit, they start to decomposition and produce ammonium and fatty acid, and that generates a solid smell. In this, these skin bacteria are different again for each person as well. Usually it's Staphylococcus, but in some people have Corynebacterium and Acinetobacterium bacteria too, and these are the worst smell caused by these decompositions. We obtain genetic and acquired cause, more frequently genetic, but in acquired cause, we need to mention organic, like diabetes, thyroid pathology, adrenal pathology, pharmacological cause, the food, when you eat garlic, onion, and alcoholic beverage. I mentioned that the patient create a special behavior to avoid other people notice this problem. They avoid hugging, they leave the movements, they move like robots, they change clothes and take showers several times a day. They use loose clothing, and even in the middle of summer, they wear jackets and sweaters. This is the classical classification, the hyperhidrosis disease severity scale, that measure the weight or the impact of this disease in the habitual activity of our patient between 1 to 4. And this is the classical classification of osmidrosis. It's the gauge test. The practitioner pass a gauge on the armpit of the patient, smell it, and rate between 1 to 5, soft smell, strong smell. And as you can hear, my explanation is really personal and subjective. Even when we reach a successful treatment about the osmidrosis, is a subjective way to obtain a classification. Please put focus in this drawing, and if you can take a photo of this, it's really important, because while the tangle of the eccrina glands usually are between 2.5 and 3.5 millimeters of depth in the skin in the axillary area, the tangle of the apocrina glands are deeper, close to 3.0, 4.0 millimeters of depth. That's why you need at least 4 to 5 millimeters of length of needle length to be sure to reach all the tangles, not only eccrina and apocrina glands at the same time in the same treatment. We have difference between the function of these sweat glands. The eccrina glands are the activity of, they have the function of the thermoregulation. Majority of our sweat came from these ones. And the apocrina glands have the function of the lubrication of the hair and the surface of the skin. We have two different kinds of treatment for this illness, surgical and non-surgical. I want to mention both of them. First, surgical procedures, endoscopic thoracic sympathectomy at level 3, T4. The problem is that, well, it's invasive treatment. It's a great surgery procedure. Invasive procedure. 80% of all patients to have endoscopic thoracic sympathectomy create compensatory hyperhidrosis over the chest and the back, and you don't have any solution when this problem appears. Cutaneous excision, of course, a great wound, a great scar. Subdermal curettage, liposuction, subdermal ultrasound, and subdermal laser are not good enough to reach the tangle of this sweat gland, because they are inside the dermis, not in the hypodermis. When we talk about non-surgical procedure, first we need to mention the topic solution of aluminum. The problem is the chronicity. If you use more than a month or 2 months, usually appear a dermatitis, a contact dermatitis, and you need to avoid this treatment. Iontophoresis is only successful for days, no more than that. Oral medication decrease all kind of secretion, not only the sweat. At the same time, the patient have problem with the oral mucosa and genital mucosa. Botulinum toxin, well, is a temporary solution, no more than 6 months. Transdermal radiofrequency, have the problem in some cases of temporary palsy or temporary hypoesthesia. Well, that in some cases a little problem. And I talk about intradermal radiofrequency. Again, our objective is a permanent destruction of eccrina and apocrina sweat glands, but without damaging papilla, dermis, and epidermis. Avoid scar, avoid injuries. We use a bipolar radiofrequency. It's important to mention that there's no selectivity. I don't look only for the tangle of the glands. I look for the depth on the layer of the skin that I choose. I can select the depth, I can select the time, I can select the intensity, and our goal is to obtain thermal coagulation inside the dermis. This is the typical objective test, the minor test. It's a iodine star test, and I show you step by step the treatment. First, I apply the iodine solution in the armpit, then the talcum powder. You want to see the mark of the area with more sweat in this patient. Look that. After that, I mark the area in which one I start to put lidocaine 2% because it's a painful treatment. And after that, of course, first I apply antiseptic solution. Here are the needles, go out from the tip of this device, and this is the way I treat my patients. I put a strong effort to be sure the needle go inside the depth I select, and this is my endpoint. If I don't reach this bruise in the area, maybe I think I don't good enough in the treatment of the patients. In the posterior indication, usually indicate moisturization with Vaseline, no more than that. I explained to avoid sun spores during the bruise, to avoid PIH, avoid vigorous exercise because some cases they feel pain or discomfort for the movement. If the patient have another problem, if have osmidrosis 2, I indicate the use of chlorhexidine antiseptic once a day to reduce the amount of corynebacterium and anaerobic bacteria and reduce the strong smell. As side effects, I found edema, swelling, some cases pain, in some cases paresthesia, but all released by itself in a matter in minutes or no more than days. And the complication like scar, burns, permanent PIH, since I use this device, I haven't had any, and this is really important for me. My present parameters, I pass 3 times in these sessions. Ideal 3 sessions, once every 30 days. I select between 3 to 5 millimeters of depth, and more 5 in male, more 3 in female, more 5 when the patient have both illness, osmidrosis and hyperhidrosis, and more 3 if the patient have only problem by the sweat, by the hyperhidrosis. I use energy level between 20 to 25 watts. My pulse duration select is between 140 to 200 milliseconds. This is my article. I do this treatment. I did this treatment since July 2014. And my first 37 patients, I have the opportunity to write a paper about that, and I can obtain a 50% of sweat reduction in 80% of the patient, but with 4% of complications: burn, scar, hypo, and hyperpigmentations. This is the free download at my website. You can do it for free. That's why by this rate of complication that I still looking for a new device, a new microneedle radiofrequency device to avoid this problem. Here I am during the IMCAS Congress. I made a live workshop of this treatment on this patient, and hear my voice.
Or scars, but
with this gentle way to send the energy, for sure, I can reach the depth that I choose. In this case, 5 millimeters of depth. And again, why I choose that? Because the tangle of the eccrina glands are more shallow, between 2.5 and 3.5 scar. Again, it's important you have a motor give you a gentle way to penetrate the needle. In this way, you for sure you can reach the depth that you select. And important too, if you have 5 millimeters of depth, because you can reach both tangles, not only eccrina and apocrina glands too. Again, the way we can send the energy, and like a train full of wagons reach the station, you leave the energy when you reach the station, when you reach the depth that you select. Some obesity tests, minor tests, before and after, before and after, before and after, and use the usual contraindication of radio frequency devices, pacemaker, pregnancy, local infection. Kalos background is a relative contraindication because it's not usual to have kalos on the armpit, and with this device, it's not usual to have any kind of burns. It's important to have a lot of paper talking about this device and this microneedle radio frequency handpiece to be sure it was tested before you start to do it. Another papers that you can ask for them to Neehar or Saurabh. Another papers. And I want to stop and mention this one. Tan and collaborators made the research about all letters talking about radio frequency microneedle, and they evaluate them, and they conclude that there are a lot and a strong recommendation or use of microneedle radio frequency for acne scar, for acne vulgaris, for axillary hyperhidrosis, and for skin rejuvenation. That's why, well, it's a fact. It's a good indication, and you can obtain good result with this kind of treatment, with this kind of device. Finally, I read the words using in this paper. Based on the above evidence, the author proposed a strong recommendation for radio frequency microneedle to be used as a therapeutic intervention for axillary hyperhidrosis. Well, in conclusion, uniform heat dissipation is important to reach more quantity of tangled needles, or glands, sorry, or sweat glands. Water coagulation around the needle is another goal. By the high radio frequency resistance of epidermis is a safe treatment. By the low radio frequency resistance of the dermis, for sure you can reach more sweat glands inside the dermis. The smooth motor for me is one of the more important of this device. Finally, all these reasons give to me and my patient a successful and safe treatment. It's another treatment of this device. If you have this device, well, why don't use for this treatment, for this illness? It's an effective and novel non-surgical treatment for axillary hyperhidrosis and osmidrosis. There's always destruction on any quantity of sweat glands. That's why we will always obtain a permanent decrease of some degree of sweating and odor. This is another fact. Without complete lesion of the epidermis, for sure, you can obtain total restitution of the skin. It's only a bruise, no more than that. And this treatment is not only for hyperhidrosis or osmidrosis disease, as I mentioned, even for everyone with high social or labor requirement that can have any kind of sweat over the armpits. Another conclusion of the radio frequency device, I use daily. In practice, it helped me a lot. I can use in all types of skin and all seasons of the year. I'm a fanatic user of CO2, but it's not for any kind of color of skin, and I can use in the summertime in Buenos Aires. It's essential to avoid PIH. It's essential to avoid headache, and help me to improve surgical result, as I mentioned and I show you, and help me to avoid surgical result that I mentioned and I show you. Finally, give an answer to the question that I made by myself. Is an effective and predictive results? Is effective and minimal complication, minimal pain, short and easy downtown? As I'm at the moment I have multiple handpiece, is at the moment I have multiple treatment and indication. I don't have any PIH, and you can obtain future handpiece and future indication. For example, I mentioned that nowadays I realized that you can use this microneedle radiofrequency for the treatment of rosacea. Thank you so much for your attention, and I prepare for Q&A.
Thank you, Dr. Fabián. It was a great session, and I'm sure we all had great insights and learning points from the presentation. There are a few questions in chat box and question and answers. I'll just read out the questions and you can take it up. So we have, what is the effect of hydrodentis supravita with MNRF?
No, in this case, unfortunately, the indication is a surgical procedure. You need to reject that. I can be successful with this one.
Okay, and we have one more. Question. What about hand and feet hyperhidrosis?
No, the problem in this area is that it's a really painful treatment for that, and the thicker the skin on the hand and feet usually is more than 5 to 6 millimeters. That's why maybe I can reach all the tangle of the sweat glands first, and second, in the axilla, the nodes are really deep. It's impossible to reach. It's impossible to damage. But on the hands, we have a lot of important structures that can be damaged with the microneedle. That's why I don't have experience in this area, and I don't give you this indication.
We have one more question, but I guess you had answered it, but still. And how many settings of RF we can expect the results, and what can be the percentage? Okay,
I mentioned that the ideal sessions are 3 every 30 days. In each session, as I mentioned, I pass 3 times. As it's an insulated needle, I don't need to change the depth of the needle. I usually put 3, 4, or 5, and 3 passes use the same. And the rate of successful, as I mentioned in my published paper, is half of the 50% of the reduction in majority of the patients. If you can be more specific, I said to my patient that my goal is to obtain 20 to 30% of reduction for sure. If I obtain more than that, well, I am really happy and the patient happy too.
And we have one more question. Any specific care while using RF and rosacea? And if yes, how many settings you have done?
No. I don't have experience with rosacea. I mentioned that it's a new indication. I found it within, made an update for this presentation. And you can look for this publication. I think it's an amazing publication with great result. But nowadays, I don't have experience with that. For sure, when I return to my city and out of the city, I start to prove in my patients.
And Dr. Fabián, you have used insulated needle also. So I would just take your feedback with insulated and non-insulated needle. How is the response of the patient, and about the session wise and result wise also?
Well, I have the possibility to test it in the same patient, the both devices, because I use non-insulated devices in many years ago. And the patient returned with the relapse of the hyperhidrosis, and I used the new one. Well, first, less pain. Second, I don't have any kind of problem, because you think I have an insulated microneedle. Okay, it's safe. Not at all, because look again, my hand. If I do that, I don't be sure that the needle go inside at the depth that I choose, because usually stop on the epidermis. That's why I send a lot of energy at the epidermis with the tip of the needle. If I have a gentle way to send the needle, like this, all the energy by the different reaction to the impedance be absorbed by the dermis. That's why on my hands, in my experience, it was more safe to use a non-insulated microneedle than the insulated microneedle.
Okay. And I guess that's all with the questions. And we GeoBio, Geomedics, and Geosmatic and Biopharmacia. Thank you, Dr. Fabian, for such a lovely presentation. And we all thank the doctors who have attended the webinar also. And surely we will keep you posted with other webinars also in future. And hope to see you, Dr. Fabian, very soon in India also. Probably we'll get chance to see you in India.
It will be a pleasure for me.
Yes, because yes.
Again, to the audience, I don't have any problem. Give them my email, and if they have any question that appear, I don't know, tomorrow, they can write to me. I really happy to answer any kind of question.
Sure, Dr. Fabian, sure. And have a safe flight. I guess you'll be flying soon, so have a safe flight.
Okay. Well, we finished. Thank you so much for the invitation. Thank you so much for the audience for the attention. Well, as you said, maybe in the future we will be face to face. Yes,
very true. Okay, bye, Dr. Fabian, and thank you, doctors, for attending this webinar. Thank you.